KwaZulu-Natal accounted for 2,440 medico-legal claims, which are valued at over 29 billion rand. For more on this, I'm joined by Dr Imran Keeka, who's the chairperson of the KwaZulu-Natal Health Portfolio Committee. Dr Keeka, good to have you on the program despite these findings. What are the most significant findings from the SIU's investigation or its probe into these fraudulent medical claims? And how have these, or rather these findings, impacted the health departments financially, that is?
So, thank you for the opportunity, Nhlanhla, and greetings to you and your viewers at home. Nhlanhla, yes, the figure is actually up to 29 billion from the end of last year. Last year, it was sitting with a contingent liability of around 20 billion rands at the end of last year, and there were 1,678 cases, so that has increased. So that 9 billion rand increase that you see there has gone up from 1,678 cases to 2,440 cases, as you mentioned, by the minister's report. Of course, it is absolutely concerning, and I've been listening to your program just now and listening to the fact that the bulk of the blame is put on unscrupulous lawyers. And I don't think that that is actually the case. I think, yes, it's a facet of the medico-legal problem that provinces have, but I don't think it is the bulk of the problem. Bulk of the problem is a broken healthcare system.
Maybe let's get into that. Of these 2,400 cases, how many of them actually involved fraudulent claims?
So we don't have the exact number yet. As you know, the department provides quarterly reports to us. We are just inaugurated now, as you know, into the GPU, where we've taken over various portfolios and where we are in the process of receiving updated information. The department at the next portfolio committee meeting, health portfolio that is, will be making a presentation to us in this regard. So we are expecting to receive the exact figures of how these may be. So we do know that there are staff members. I heard earlier, Nehau, for example, rejecting the fact that their members sell files and documents to unscrupulous lawyers, as it is suggested. The reality is that it happens because these files don't miraculously fall out of the sky into the lawyer's hands. There's somebody that colludes with them in facilities that make sure they get them. Some of these cases are actually shocking if you listen to the snippets that I have listened to from the minister on the wireless regarding how and what cases they have investigated and found to be actually fraudulent in terms of the manner in which they were claimed. So this is a reality, but there are other things that contribute to it, like I say, and the broken healthcare system with simple things. I'll give you an example. We have a report that says that in terms of medicine stockouts, and the report suggested to us that there are 5% medicine stockouts in the province. Now, the number might seem insignificant, that 5% of people don't get their medicines. But it's those 5% of patients whose conditions deteriorate because of the stockouts. You take emergency medical services. Ambulances don't reach people on time. People have to give birth at home. People have to wait long periods of time to receive emergency medical care. Those people get more sick by the time they get to facilities, requiring more interventions, and adds to the burden of medico-legal claims. And I'll give you another example. Medical records, which seems to be the focus here, are a problem in KwaZulu-Natal because only a portion of our hospitals have electronic medical records. Unlike the Western Cape, where the DA governs, all facilities have their medical files on an electronic format. That means they can't be changed, they can't be altered, they can't be copied, they can't be sold. So not to say that people can't sit in front of a device and take screenshots, for example. I mean, that's always possible. But the reality is this, that if you take care of these problems, then this contingent liability against the department of 29 billion rands certainly decreases. So we have encouraged the MEC, of course, in our budget debates recently, and we do this via this medium as well, to call for that to be sped up. So these are the kinds of things. So these medical records, if they are in those electronic formats, they won't be able to be sold, they won't be able to be changed, they won't be able to get lost. A simple thing like toner printers. There are many hospitals are reporting a shortage of. I, for example, sometimes I make notes, and when I go back to read them a day or two or even a week later, I can't read what I wrote. And medico-legal cases are lost because of these notes that are illegible. So a simple thing like toner cartridges, where a doctor would sit, type out the paperwork, put it in a file, inter-facility transfers and referrals that are made are done in a format that is legible, reduces these claims. I'm just giving you a few simple things. So these are the kinds of things that we need to look at to ensure that medico-legal claims across the country lay blame, at the door of unscrupulous lawyers entirely. I don't think that's the problem. I think the problem, again, as I said, is a broken healthcare system with simple things like toner cartridges and improper records.
Well, as a recommendation, it has been proposed that digitizing the systems might offer some remedy to this situation. Let's speak to that. What measures are being implemented to prevent future fraudulent claims, and how effective are these measures expected to be?
Well, clearly, the province that has managed to massively reduce the medico-legal claims involving records, as I earlier mentioned, is the Western Cape, and that is because they've managed to digitalize all of their records. And going back many years, it means that if a nursing sister in a clinic sits with the records with a patient and enters notes on a system, if that patient is sick enough and reaches a tertiary facility, for example, Grooteskier Hospital, they would be able to access even the nurses' records that were made in the clinic. And that removes the entire process of not having access to all of the details of the patients at any time.
Right.
So if a patient presents in an emergency, in a casualty where their problem has complicated, again, those records would be instantly available. Now, the Department of Health in KwaZulu-Natal would clearly cite, if you had to interview the MEC or the HOD and ask them why aren't they doing this, they will cite the lack of funding. And really, there is no money to do this. However, like the Western Cape, we have said to them during that debate speech that we need to source donor funding like that province did to digitize its records. And I think this will absolutely mitigate. I'm not saying that doctors don't make mistakes and nurses don't make mistakes. The reality is they do. And those cases obviously will be weighed up, and where they can't be defended, they won't be defended. But where the problem lies in record keeping, that can be remedied, and donor funding is one of the ways to go. And that is something that we've spoken to the MEC for Health in KZN, and we've made a suggestion how that donor funding can be made available, and we now need to work on sourcing it.
So to put it loosely, you've diagnosed the situation as a result of a broken health system. But can you describe the role of collusion between legal practitioners and also health officials in really perpetuating these fraudulent claims?
Look, we haven't surgically dissected it, if I can use the analogy.
Sure.
Going on from your health analogy. We haven't dissected it to the point to examine, determine, what is the role of that collusion. And how, as they correctly said, there's not one person that they can identify. That is because it happens in such a way where if a person picks up a file from a filing cabinet and hands it over to a lawyer, they took it home in a bag, who's going to know? There's nothing to monitor where it went, who accessed the record, because it's paper-based. That's the problem. The moment it becomes an electronic transmission, say, for example, somebody emailed a record from one place to another, there would be a digital footprint that will probably be able to be traced.
Right.
So the extent of that collusion is hard to say at the moment, particularly because it is paper-based and largely because, they write it off as a file that is lost and another one is simply opened, and it continues like that. Patients who visit our facilities will tell you often. I'm not saying that every lost file now is something that was handed over to a lawyer, but certainly people are making money out of this entire thing, work in the healthcare system. The thing is that this is a reality.
And I guess that's the problem. What are the legal, but also the administrative consequences, if you will, for those who are found guilty of submitting these fraudulent medico-legal claims?
Well, there's two aspects to that. I mean, there should be consequences in terms of the legal profession for fraudulent matters that they bring. So if the chain of evidence was obviously fraudulent, it means they obtained the information fraudulently, not through proper means by writing to the department through the proper channels, and using the department's legal services to obtain the records. But they obtained it from somewhere and made a case. There should be consequences for this. I can't comment on that because I'm not a legal expert or a practitioner. Certainly, the law society or registering authority of the legal practitioner should be able to tell you what those consequences are, and I believe that they should be. And obviously, if the person identified in the patient's care that leaked the records, or if it came from somewhere else, I'm very certain that there must be consequences for them within the HR system that must be applicable. Because clearly these patient records are confidential documents. They can't just be taken and shared with them. There are consequences that we know that we all subscribe to in so many aspects of our life. COPIA, for example. So those are things that everybody knows, that patient records have always been confidential and have always been only accessible to those who the patient gives consent to and who are involved in the patient's care where they cannot give consent in terms of emergencies.
But Dr. Keeka, given the complexity, but also the scale of these fraudulent activities, what additional steps are needed, in your view, to really strengthen oversight and accountability within the health sector?
Look, I think the quickest remedy would be to digitize the records. I think moving in that direction faster, looking at the donor funding in whichever province it is, particularly in KwaZulu-Natal, given the size of our province, the population size, and that at least a minimum of 98% of our province depends on the state healthcare service. I think that we need to move in that direction quickly. I think that contingent liability is a liability on the department that is dependent on, whether the summons have been issued and whether it will be paid out and where they are with the legal processes can be mitigated against if these simple things are put in place. I think the other thing is very important to emphasize, and I think the MEC touched on it at some point during her budget debate, about talking about the ethics of practitioners and people within the healthcare system that handle these records. I think there needs to be an emphasis in training and reiteration, and probably, if examples are set where these people are identified, then I think that will tighten up the processes.
Now, as we begin wrapping up our conversation, how do you foresee the ongoing investigations and also these actions taken by the SIU? How do they affect the future of medical legal claims, but also the overall health department management?
Look, I think I can speak to the idea of if everything had to be paid out. The health budget currently sits at around 52, 53 billion rands there in between. I think if all of the 29 billion rand is paid out tomorrow, if all of the cases are settled tomorrow, in the next year or 2 or 3, then the entire health department in KwaZulu-Natal will collapse. You won't be able to deliver any services, emergency services. You won't be able to perform any operations or dispense any medicine. Rather close up your hospitals and go home. Obviously, this is a massive department, 24/7, 365 by its operations, and it's not possible to do that. So the department will obviously have to defend every matter in the best way possible, settle with those matters that are indefensible, and where they can decrease the claims. That means use a holistic approach to a particular claim of incapacity, for example, by ensuring they work with the Department of Human Settlements to provide housing, the Department of Education to provide for special need education, and holistically approach the problem of the person affected where the case is indefensible. Certainly the claims can be decreased. The contingent liability, that 29 billion rands, especially where the summons have been issued, are not that many at the moment. At the moment, they're probably around 6 billion rands. Those can actually be reduced by ensuring this holistic approach where the various other departments, including social development, are brought in, and the risk to the department can be mitigated against. So there is a holistic approach that is required. We call it a whole of society approach when it comes to crime and other ways.
Yeah.
It's the same approach that needs to be used in health, where you have to have a whole of society approach and holistic approach within the department and using other government departments to bring down claims that the department eventually has to pay out.
Dr. Keeka, thank you so much for your time and sharing your insight.